Hello, my name is Jasim from Jasim Al-Mosawi Counseling. In this video, we will be discussing what is driving anxiety, the cause of driving anxiety, the symptom of an anxiety, and we will cover some technique to help overcome driving anxiety. So, what is driving anxiety? Driving anxiety is a fear of being in a vehicle or driving a vehicle, sometimes referred to as a phobia of driving that results from persistent and intense fear of driving or being in a vehicle or as a passenger. So, uh, what are the causes of driving anxiety? There are many causes of driving anxiety, such as involved in a motor vehicle accident or witnessing motor vehicle accident or negative experience such as driving in a storm or a bad condition. People feel anxious and afraid to drive in general, driving sometime over like a bridge. Sometimes people feel afraid to drive on a highway or under a tunnel. Sometimes they feel they lose control when the vehicle is driving fast. So, what are the symptoms of driving anxiety? There are many symptoms of driving anxiety, and the symptoms normally depend on the individual and also depend on the intensity of the anxiety. Driving anxiety is not recognized as a mental health disorder by American American Psychiatrist Association. However, driving anxiety is a serious condition and a major issue that a lot of people struggling with. And as mentioned, there are many symptoms of driving anxiety. And it depends on the individual and intensity of the situation. So there are like a physical symptom, behavioral symptom, and emotional symptom. So we'll be discussing the physical symptoms, talking about a few examples of the physical symptom, and also talking about a few examples of the behavioral and emotional symptom. So physical example of physical symptom is the person feel restless or they feel on edge when they are thinking of driving. The person feeling tired and easily fatigued, and often after the person is driving or even being in a vehicle, having trouble to concentrate, or sometime having trouble when driving also. Person feel irritable and also short, and also the person feeling tense, especially around the neck area here, because the person when they're driving they feel very tense when holding the steering or even when being in the vehicle. Having trouble with a dream, sometimes dream issues, a lot of a dream about driving, being in motor vehicle accident. So these are some of the behavioral. Sometimes people feel they have they sweat so much, or they feel lightheaded, or feel dizziness, or they feel like pain in their chest. So these are some of the physical symptoms. Again, there's many physical symptoms, but just this is in general about physical symptom. Emotional symptoms: the person feel apprehended when thinking about driving, feel really agitated when thinking about driving, feel negative, and sometimes the person that is like the emotional symptom. So and the person feel have a difficulty concentrating. The person feel tense and jumpy, irritable. Also, some of the emotional symptom, feel overwhelmed, with thought and really feel very tired and overwhelmed. Behavioral, the person avoid driving, avoid being in a vehicle in some situation. Sometimes people change route. You see them they are changing route from to avoid some certain situation, to avoid some places that they might have the accident in that places, or they experience bad experience in that places, so they avoid. So these are some of the behavioral symptoms. So again, we mentioned that we have physical, we have behavioral, we have emotional symptoms. How can we help people with anxiety? Really, number one, to help people with anxiety is therapy. Very, very important for individual to seek therapy. Cognitive behavioral therapy, very, very well-known technique that help with the driving and anxiety. And people should not suffer. They should seek help, and that's why we're talking about this video. We encourage people to seek help and talk to a therapist. So some of the technique that can be helpful for driving and anxiety, that the individual need to understand his or her own symptom. So really need to understand what are the physical symptoms, what are the emotional symptoms, what are the behavioral symptoms in their own. They need to have a list of their symptoms, and the reason for that is when the person become aware of their symptom, they will start to make some changes. They started to really kind of relate their symptom into the situation of anxiety. So not having a symptom but not understanding what's going on with them. The number two, the person need to set up some goals. So goal for driving or being in a vehicle, and the person need to start small and then gradually start increasing that goal. So for example, maybe a goal being around the vehicle, or goal be sitting on the driver's seat or in a passenger seat, or maybe putting the key inside the ignition and starting the vehicle, maybe cleaning the vehicle. Smaller goals, and slowly maybe driving around slowly back and forth, maybe driving around the block or around their home. That's some of the goals. So gradually, and that's why we need therapy, because the therapist will be working with the mental health therapist will be working with the individual to help them. And number three, practice mindfulness. So when the person is in the vehicle, they need to practice mindfulness. They need to be aware of what's their surrounding. Maybe take a sip of cold water and thinking about the water, thinking about vehicle around them, thinking about listening to music, maybe whatever. They need to become aware of what's surrounding them. Number four is taking a deep breath and counting to 4 when breathing in, pausing for 4, and exhaling for 4. So we call it 4 square. Breathing in for 4, pausing for 4, and exhaling for 4. Number 5, trying to relax. Technique that can be very helpful to reduce anxiety, because really the opposite, like fear, we need to the opposite of that is relaxation. So relaxing yourself, forcing yourself to relax by engaging in visualizing, maybe by taking a deep breath, by thinking positively, and that can be very, very helpful exercise that people can be engaging in. Physical activity like exercise can be very, very helpful too, so to help with anxiety. So these are some of the example of what is driving anxiety, kind of in general, not really in specific. We really encourage people, if they are experiencing any of the symptom and struggling with driving anxiety, we encourage them to contact us. There is a lot of help contact us or contact your health provider or contact your mental health. There's a lot of help for people with driving anxiety. Again, this is not a session, this is just a general information to help with the driving anxiety. If you have any question, just give us a call. Information will be posted on Facebook and also YouTube account Jasim Al-Mosawi Counseling. Okay, thank you very much.